Hi everyone, welcome back. Well, as you know, February is Heart Health Month, and here's something you may not know. There is really such a thing as being diagnosed with a broken heart. And doctors warn in this particularly stressful time with COVID that people could be more prone to it. So joining us to explain more, we have cardiologist Dr. Venu Channamsetty with Hartford Healthcare Heart and Vascular Institute at St. Vincent's Medical Center. Doctor, I want to thank you so much for joining us, first of all.
Thank you.
So tell us, what is broken heart syndrome?
Yeah, so there is something called broken heart syndrome. I want to start by showing you a model of the heart. We talked before about the arteries that supply blood to the heart muscle. If those get blocked, that's called coronary artery disease, and it can cause a heart attack. And what happens in that situation, you have weakening of the heart muscle. In broken heart syndrome, you also have weakening of a large part of the heart muscle, but there's no significant blockage at all. And it's actually due to a severe stressful or emotional situation or severe physical illness, but that's why they call it broken heart. People have a broken heart, and that can actually cause it. It's actually known as Takotsubo syndrome. Takotsubo is the Japanese word for octopus trap. And what happens with the heart, it gets so weak at parts of it that it balloons out and it takes the shape of an octopus trap.
Wow. So what has actually triggered broken heart syndrome? Can you give us an example as to what might do that?
Yeah, it's very sad. It usually happens in an extremely emotional situation. I've had a couple patients who lost a family member, one recently who lost a son, and the shock of that news caused her to have this condition. And, you know, serious physical illnesses can cause it as well. Severe infections that actually didn't involve the heart can cause it too. But it's more likely I've seen with emotional situations. And, you know, what I found is we found some theories are there's a surge of hormones, stress hormones like adrenaline and this stressful situation that causes direct damage to the heart muscle, or the arteries start spasming due to that, and the weakening of the heart muscle can occur.
Wow. Have you seen more cases like this during the pandemic?
Yeah, unfortunately I have. It's a stressful time. You know, people are receiving some bad news. In fact, a recent study showed that the incidence of this condition has gone up significantly during the peak of the pandemic. Significantly, it's gone up multifold because of the stress we're all experiencing. So it's something to watch out for.
Oh, I don't like hearing that. That's so sad. And is there treatment out there for this?
Yeah, there is. I mean, first we have to make the right diagnosis by getting a good history, getting an EKG, an ultrasound of the heart, and also something called an angiogram, which is a procedure where we look directly at these arteries to make sure that blocked arteries are not causing them. The treatment is we use medications to make the heart pump more efficiently and take some stress off of the heart. And also we use medications to keep fluid from backing up into the lungs, something called heart failure, to make sure that our lungs are kind of inundated with fluids.
And the signs this may be happening similar to a heart attack?
Yeah, that's the thing. It's very similar. The symptoms are often chest pain, shortness of breath. In extreme cases, patient will just faint from the news, and in fact, it's not a heart attack. And that's the first step, is for us to make that diagnosis, because the treatment's very different between the two conditions.
Okay, doctor, thank you so much for your time today. A terrible subject here, but really important to raise awareness. Appreciate it. Thank you. And I know people can go and get more information at hartfordhealthcare.org/heart. Thanks a lot for your time.
Thank you for having me.
We'll be right back.